Hi everyone, in this video we're going to take a closer look at asystole. Now you're going to find asystole in your adult cardiac arrest algorithm where it says, is this a shockable rhythm? If it's not a shockable rhythm, is it asystole or PEA? Well, let's talk about asystole for a minute. Asystole has nothing to do with the electrical activity that you're seeing on the monitor. Asystole means without contraction. That's what it means, A without, systole, contraction. So this is without contraction. This is a heart that not only is electrically silent on the monitor, infinitely more important, you have no mechanical contraction of the heart. So this is a heart that is not working. Now, what is our strategy for treating asystole? Well, patient doesn't have a pulse, so immediately begin chest compressions.
Don't worry, I know CPR.
I'll get the pills.
Out with the battery.
And the first drug we administer in any cardiac arrest is epinephrine. So compressions and the immediate administration of IV epinephrine, 1 to 10,000, 1 milligram, IV push with a flush. Now, I have resuscitated asystole just using epinephrine. Epinephrine is the one drug that will start a stopped heart. So epinephrine is indicated. Now, as it turns out, asystole and PEA can occur immediately after defibrillation. However, you should never know that. Why? What do we do immediately after we defibrillate the patient? We begin chest compressions and we administer epinephrine. So let's say you actually did defibrillate the patient, they went into asystole, you're not checking the monitor, you're going to get right back on the chest, begin your chest compressions, administer epinephrine if it's the first drug you're administering. You check the rhythm after 2 minutes of quality chest compressions and ventilations, and lo and behold, they're in VFib or some other rhythm. You had actually defibrillated them into asystole, but you never knew about it. That's one of the reasons why the AHA recommends going right back on the chest after you defibrillate them, because asystole and PEA can occur immediately after defibrillation. Now you're probably thinking asystole, and you wouldn't be wrong. Asystole is usually a terminal event. It's an end-of-life event. Your patient most likely is not going to survive. However, our hope is that we can find the cause quickly through our H's and T's and treat that cause. Now back in the day, if I had shocked a patient into asystole, I would pace them right away. And I've had success with that. However, know that that is no longer an AHA recommendation. I've used it, it's worked, but it is no longer a current recommendation to transcutaneously pace a patient you had defibrillated into asystole. Find the cause and treat it. I'm Mark, thanks for watching, see you in the next video.